Thank you, Lisa. Tonight we're going to discuss the St. Louis County response to the COVID-19 epidemic and how we would prioritize our CARE Act federal relief for our St. Louis County community. This slide shows the total cases. To date, we have 1,173 total cases, 144 new cases in the past 24 hours, and 24 lives lost. The number of COVID-19 cases has grown exponentially over the past 2 weeks, and we can see that here in the dark blue line in this graph. The bottom light blue line is the number of daily new cases, and we can see that growth as well. The age distribution of the COVID-19 cases makes what looks like a relatively traditional bell curve, with a higher distribution age 50 to 59, and then another peak in the 20 to 29 year range as well. This next slide shows a zip code map, emphasis in northern St. Louis County and west St. Louis County, but we expect this to fill in over the coming days and weeks as the virus spreads in our community in a more traditional manner. This just shows the initial impact of the virus in our community. COVID-19 deaths tend to be predominantly male, as this first chart shows. The overwhelming number of people who do not survive a COVID-19 infection have chronic medical problems. That's what this second pie graph shows in dark blue. And then the third shows the age distribution. As we would expect, the older patients tend to do poorly with a COVID-19 infection, and that's why our resources are pointed in that direction. This crisis has 3 pieces. It is a public health crisis, it is a humanitarian crisis, and it is a subsequent economic crisis. St. Louis County has 3 priorities: to save lives, to help our residents meet their basic needs, and to revive the local economy. And that's what I'd like to focus on tonight. Saving lives has 2 points. First, to flatten the curve, and second, to increase our health system capacity. Flattening the curve is a traditional public health approach: prevention through all of the methods that we've discussed, and then testing and isolating patients that have been diagnosed or are presumptive positive with COVID-19. Our health system has worked in a very coordinated way to increase their resources, increase their capacity, and work cooperatively together. So prevention on the public health side includes our hotline services by both our public health agencies and our hospitals, our website, stlcorona.com, where most of our information is gathered, our communications with the media. There are some billboards in the community as well, social media presence in informing the public as to the proper things they can do to help themselves and where they can get services, and then our conversations with stakeholders. This shows the volume of calls through our hotline over time. We can see that start to fade as patients are able to access our hospital system information services and are also finding information through our website and social media. Visits to stlcorona.com continue to be robust. One-day visits on April 6th were 5,997. The total last week was over 57,000. The total last month, 146,000. Flattening the curve has been what we've talked about the most, and those are through our social distancing measures. We've limited crowd sizes. We've limited restaurant services from dine-in and only allowing takeout and delivery services and curbside services. We've limited non-essential activities, and then most recently we were forced to temporarily close our parks in St. Louis County. This shows the travel through Google Analytics in our community in St. Louis County. Retail travel is down 45%. Transit station travel is down 59%. But in the upper right hand, we notice that travel to our park is up 87%. And we knew that would increase following actions taken in St. Louis City to limit access to the parks and the action by the state of Missouri to close some of their parks. We expected crowding to increase in our parks soon after that, and that was one of the reasons why we were forced to temporarily close. The test piece of flattening the curve has been difficult in this national environment of extraordinary limited testing. We have worked to expedite screening following the CDC guidelines for testing. We've worked vigorously to access more tests through our resources, and we have worked aggressively to make sure that testing, however limited, was available equitably in our community. We continue to quarantine and isolate appropriate individuals, patients who have tested positive or who have symptoms and are presumed positive are given isolation instructions at home, and if necessary, then we have resources to isolate them or quarantine them in a hotel, which we have done with some of our first responders and some of our patients who don't have a place, such as our homeless population. This next slide shows our testing locations in the metropolitan region, including St. Charles County, Franklin County, and St. Clair County. These also show the St. Louis City and St. Louis County locations. As you can see, these are relatively evenly distributed, working very closely with our hospital systems. So building our health system capacity has been one of our top priorities, not only increasing the number of hospital beds, but ICU beds. One of the first strategies deployed by our health systems was to stop elective surgeries, to make room in their hospitals. They have recruited extra medical personnel and have worked very hard to acquire supplies and equipment. Our hospital systems are working very closely together in a coordinated way to increase data sharing, to streamline policies and procedures, and to coordinate their activities and keep track of their ICU capacity and ventilator capacity. We have created a St. Louis Metropolitan Pandemic Task Force through our health systems to provide us with a single point of contact to coordinate hospital activities and to work with our public health systems. Leading that effort is Dr. Alex Garza, who is the Chief Medical Officer at SSM Healthcare and a former Chief Medical Officer of the U.S. Department of Homeland Security in the Obama administration. St. Louis County's first priority is to save lives. We have initiated that through first community awareness and communication, establishing and enforcing social distancing policies, and isolation and quarantine practices. The health system has worked to make testing available in our community, to make sure those tests were distributed equitably, and to build the health system capacity and coordinate their efforts. This shows the traditional curve of an epidemic. The dotted line across the top is the health system capacity prior to the techniques and adjustments that have been made to increase capacity within hospitals, and the adjustments that we have heard about through the St. Louis Pandemic Task Force. Our second priority is to help our residents meet their basic needs. This means food, housing, safety, physical and mental health, a special attention to our vulnerable populations, including children, seniors, those in senior living facilities, individuals with disability, and people without a place to live. So as we watch our curve on our effort to meet basic needs, we can lay that on top of the epidemiologic curve for COVID-19 infections and cases. As we see the initial rise of the curve, that's when our residents need the most help. We are planning appropriately, and we understand as we get to the other side of the curve, we can start to open up our travel into community and ease restrictions. And we will continue to focus on basic needs, but we would expect those resources to be adjusted. Our third priority is to revive the economy. That means invest in our workers and workforce development, support our local businesses in the recovery to make sure we're using our county resources to match our local businesses with federal support in the Stimulus Act, and then reboot our government services, make sure we're providing the services that are needed to support our economy and restore us back to our traditional operating level. As we see in this slide, we mark the curve for the epidemiologic trend. Helping our residents meet their basic needs is the bottom blue line, and then we begin our efforts to revive the economy. As the case count starts to fall, we can ease restrictions and start implementing our task force that is dedicated to the economic recovery. The Federal CARES Act provides funding for the response to the COVID-19 epidemic. We will be watching liquidity and financing through federal programs that we can help match with our small businesses and other employers. And then there is also support for transit, our transit agencies, to make sure that our residents have a way to get to work and to get to school and to support workforce development and a return to full employment. The state is currently working through the Federal Stimulus Act, appropriating that at the local level through various programs. St. Louis County has the benefit of being able to access the federal treasury directly, but we also recognize that so much of our programming is coordinated regionally, and our regional partners will depend on the state appropriation, which we expect to move very quickly, and we'll be working with them in a coordinated way, just as we are in the pandemic response on the public health side. So to review, the St. Louis County approach to this pandemic is to save lives, help residents with our basic needs, and revive the local economy. Thank you.